All right, welcome. Today we are diving head first into the world of psychological assessment. It's this fascinating process for really getting a handle on the complexities of human behavior. It's so much more than just a simple questionnaire. Honestly, it's a powerful tool that can provide these incredible insights that can totally shape careers, education, even our own personal growth.
But let's be real for a second. A single test score, well, it rarely tells the whole story, does it? It can feel so limiting, almost like a label. It's just one tiny piece of data. So the big question is, how do we see the full picture? How do psychologists and counselors look past that number on a page to see the entire person? Well, that's exactly what we're going to explore. Okay, first things first. We've got to clear up a really common point of confusion. You hear the words testing and assessment thrown around all the time, sometimes like they're the same thing. But in the world of psychology, nope. They mean very, very different things. Yeah, this lays it out pretty clearly. The best way to think about it is with an analogy. Psychological testing, that's kind of like going to the doctor for a single blood test. It gives you one specific result, right? One little data point. But psychological assessment, now that's the whole shebang. It's the full, comprehensive medical checkup. It's this much broader problem-solving process where tests are just one of the tools in the toolbox used to build that complete picture. So to put a more, formal definition on it, assessment is a process. It's not a one-and-done thing. It is all about integration. It's about bringing together all sorts of information from tests, sure, but also from interviews, from personal history, all of it, to create this cohesive, deep understanding of a person's inner psychological world. And, this quote from the psychologist Anne Anastasi, it just nails it. She calls it an extremely complex process of solving problems. It's not about passively measuring something, it's an active investigation. The test is just one method, one tool for gathering clues, not the final answer itself. Love that. Okay, so now we have a good handle on what assessment is. But the next logical question is, why do we even do it? What's the point? What's the end game here? Well, it really boils down to 4 core goals. And these purposes are super practical. They're not just abstract ideas. First, you've got selection and classification. Think about a company trying to hire the absolute right person for a really important job. Using good assessments here can seriously cut down on employee turnover because you get a better fit from day one. Then there's diagnosis and treatment planning. This is absolutely essential for a therapist to create a treatment plan that's actually tailored to the person. It also helps predict future performance, giving us a clue about how someone might do in college or a new job. And finally, it's a huge help in guiding people toward educational and career paths that they'll actually find fulfilling. But look, a process this powerful, you can't just wing it. It absolutely requires a rock-solid ethical foundation. It's guided by these essential rules of engagement, you could say. These are core principles that make sure the whole thing is fair, it's accurate, and, probably most important of all, that it's actually helpful to the person involved. Really, it all rests on 3 main pillars. First up is a holistic approach. This means looking way beyond the scores to understand the whole person. That includes their cultural background, their social life, everything. The second pillar is objectivity. This is all about using accurate, reliable tools, but also having the humility to remember that we're dealing with probabilities, not crystal ball certainties. Humans are complex. And the third pillar, the one that is absolutely non-negotiable, is confidentiality. And let's just pause on that last point for a second, because it is so important. Confidentiality is the absolute bedrock of trust between a counselor and a client. It's the promise, the safe space that allows someone to be truly open and vulnerable. If you don't have that trust, the whole thing just falls apart. It's a fundamental ethical requirement, full stop. All right, so we've covered the what, the why, and the really important guiding principles. So now let's actually walk through the process itself. What does it look like step by step? Let's trace the journey from that very first question all the way to the final report. It really follows a clear 4-step path. Everything kicks off with step 1, the referral. This is where we define the core question. Why are we doing this in the first place? Then you move to step 2, data collection. This is the active phase of gathering all the info using different tools. Step 3 is integration. This is the really crucial part where you analyze everything and make it all make sense together. And finally, step 4 is reporting, communicating the findings back in a way that's actually clear and useful. And just look at what's involved in that data collection step. It drives home the point that this is so much more than just a test, right? A really thorough assessment is going to include deep interviews, careful observation of behavior, and digging into case histories or past records. Each one of these methods gives you a totally different angle, a unique piece of that puzzle.
And that brings us to what I think is really the art of the whole process: integration. This is where the skill and experience of the professional just shines. They aren't just listing off a bunch of data points. No, they're weaving everything together: the interview notes, the test scores, what they observed, to create a single, coherent, and insightful story about that person. So, when you boil it all down, the most crucial point is this: psychological assessment helps us move beyond a simple score or a single limiting label. It gives us a rich, detailed, and honestly, a more compassionate understanding of a person. And that really leaves us with the most important question of all, doesn't it? Once we have this amazing insight, this clearer picture, how do we use it to actually help someone grow, heal, and ultimately to thrive?